Good day. My name is Dunamis Orr, and this is my presentation on intellectual developmental disorder. Intellectual developmental disorder is also known as intellectual disability. This disorder, as defined by Peritz and Troy, is a disorder that involves a lack of proficient intellectual functioning and deficits in the way one conducts himself or herself. According to Peritz and Troy, adaptive functioning is also deficient in individuals diagnosed with this disorder. Adaptive functioning refers to the efficiency a person has while participating in daily tasks and also in abstract, theoretical, and social settings. The Diagnostic and Statistical Manual of Mental Disorders state that there are 3 criterion that must be met in order for an individual to be diagnosed with intellectual developmental disorder. These include intellectual functioning deficits, adaptive functioning deficits, and both intellectual and adaptive functioning deficits have to begin early during childhood development. According to the Diagnostic and Statistical Manual of Mental Disorders, intellectual functioning deficits include deficits in reasoning, planning, abstract thinking, judgment, and academic learning, while deficits included in adaptive functioning include not being able to fully comprehend and participate in daily living activities. These are the therapeutic approaches that will be discussed in this presentation. The theoretical foundation for the physiological pharmacotherapy approach is this disorder is caused by irregular genes in an individual's brain. Pharmacotherapy can be used to help the abnormal genes causing the disorder. Peritz and Troy stated that psychotropic medications can be used to treat this disorder. Treatment includes medications such as risperidone, lamotrigine, and lithium carbonate. In a research completed by Wetmore and Garner, fluoxetine was proven to be helpful for participants with Down syndrome. Wetmore and Garner also stated that lithium carbonate can be used for Fragile X. Medications used to treat this disorder can work properly when accompanied by psychological strategies such as CBT and/or mindfulness therapy. The theoretical foundation for CBT is this treatment can help patients with this disorder through exploration of the patient's thoughts and behavioral patterns. A study completed by Dagnan, Jackson, and Eastlake in 2018 showed that CBT was helpful in helping individuals diagnosed with this disorder. CBT was used to decrease the patient's anxiety through verbally expressing their worries and then getting the help they needed. Techniques used by Dagnan et al. To help the individuals with IDD were the relation technique and the exposure-based technique. Several factors of the CBT treatment for IDD showed promise for the individuals who participated in this treatment. According to Peretz and Troy, children and adolescents with this disorder who have supportive parents and family members can provide the patients with much hope, positivity, and optimism. The therapeutic treatment for this disorder is family-centered support. However, parents don't feel comfortable making the primary decisions for their children's health. According to Dempsey et al., parents with children who have this disorder would rather trust doctors and psychologists to help their children's physiological and mental health. A scripture-based technique that can be specifically used for IDD is speaking positively over oneself and about one's mind. The New International Version of Psalms 139 verses 13 to 14 states, and I quote, "For you created my most inmost being. I praise you because I am fearfully and wonderfully made. Your works are wonderful. I know that full well." End quote. These are the references for the information used in this presentation. These are the references for the information used in this presentation.